Good afternoon. I'm Dr. Bob Underwood. I'm the Chief Medical Officer here at San Juan Regional Medical Center, here to do the weekly update for San Juan Regional in our world of COVID. Today is June 26, 2020, and we'll talk about some things that are going on at the organization within our community and what we're seeing around COVID right now. Before I start, I just want to say how proud I am of this organization. Our ability to respond to what has happened, what is continuing to happen. We've been up over a hill and we're now coming down on the other side, but we know it's not over. And this organization has been amazing in terms of its ability to respond to this need for our community, for the Four Corners region. All right. First, I want to say for important updates, there are resources that you can go to at our website, sanjuanregional.com/coronavirus. You can get more information, things that are happening at the organization. As you can imagine, it's an amazingly dynamic situation. And so to be able to stay up to date, please take advantage of that resource as well as others that are available at the state through the Department of Health. So let's talk about transmission rate. A lot of you have heard the term R naught, or R with a little zero next to it. And that has to do with how many people, if one person has it, how many people they might infect. On average, right now in the state of New Mexico, that number is 1.08. Mathematically, you got to get that number below below 1.0. In order to say that your pandemic is under control. So we are not below 1.0 yet, but we have gotten closer. Now, we were better a week or two ago, and now that number is starting to climb back up. So we need to be careful about that. And the big things are wear a mask, social distancing, those things still work. That's what prevents the spread of the disease. And we know that people who don't have symptoms are spreading that disease to other people unknowingly. Now, let's talk about it regionally. Here in the northwest corner of the state, our R effective, or our R naught value, is 0.97 right now. And that's good, but it's also creeping a little bit up from where it was. So we're doing better than we were several weeks ago, but in the last week or two, we started to creep a little bit back up. So again, social distancing, go out, try to support businesses that are taking the appropriate precautions, but we need to make sure that our R effective value, or that R naught value, stays below 1. All across the state and across the country. We've heard a lot about states around us. That number is going up. Record highs in some of the states that border New Mexico. And so we have to take special precautions for ourselves so that we're not spreading it to others. If we look at the prevalence rate within the Four Corners area, the northwest corner of the state, our prevalence rate, which is the number of patients who have been infected per 100,000 of population, as you know, we really took the brunt of COVID over the last several months for New Mexico. And so you could see that our numbers, that column, that blue column, is incredibly high. 2,409 per 100,000 population compared to the rest of the state, which is only at 502.7 overall. But again, our R naught is the best in the state right now. Our R effective value is the best in the state. And we need to keep that up in order to keep that from going up. If you look at mortality, which is the death rate, in terms of what region had the most deaths, of course, we had the higher disease burden in the state for COVID. And so our death rate also was higher than the rest of the state in terms of the percentage of deaths across the state. And that's what that green line means on the graph here. So let's talk about San Juan Regional Medical Center and things that are happening at our facility right now. As of this morning, June 26, 2020, our total number of patients at the hospital was 115. We have 14 patients that are COVID confirmed. That means they have had a test and it was positive. We have 11 patients in the hospital right now that are waiting for tests to come back, but they are highly suspicious for being positive for COVID again. So that puts the number that we're kind of managing in that way at 25. So intubated patients at the hospital right now, we have 5 who are intubated on ventilators. 4 of them are in our COVID positive intensive care unit. So overall, our census, or the numbers to date, so this goes back to the beginning of the pandemic until now, the total number of cases that we have had at San Juan Regional Medical Center is 365 positive cases. We have discharged 290 patients. We're pushing the 300 mark of discharges of patients who have had COVID at our facility. And unfortunately, we have had 61 patients die at our facility. Still in-house, based on the numbers that I just gave you of positives, we have 14 positives that are still at the facility right now. So this is a trend graph, and you can see the up and down that we've experienced over the course of the last couple of months. Now, the blue line at the top is the total number of patients that we've had at our facility. The next line down is purple, and that's combined between those patients that are suspected. The PUI is what it is listed as on the graph. And then the green line is actually those that are positive. You can see that that's trended down, but we've got a little uptick here in the last couple of days. Again, that's following along with what a lot of the other states around us and our state has been seeing. And so we're hoping that, unlike the other states, we're not going to start seeing record numbers again. So here's a couple of things that are going on. The rate of transmission over the past week has increased statewide. The northwest region of the state, here in San Juan County, as well as down in Cibola County, McKinley County, we're actually now, we did have the worst rate of transmission, but now we've got the best in the state. So we need to keep maintaining our appropriate precautions, hand washing, face mask wearing, social isolation, etc. So there's been a steady continued decrease in the number of hospitalizations at San Juan Regional Medical Center. Over the last couple of days, we've seen a slight uptick, but we don't have a trend yet, and we need to make sure that we're doing the appropriate things within our community. The clinics for San Juan Health Partners, the clinics here in the area, we're starting to open up. So call your physician if you need to be seen, regular screening, exams, etc. Now, we're still trying to encourage, where available, we're still encouraging virtual visits, doing it via telemedicine. That helps us maintain those precautions. Obviously, you can't spread COVID via a television camera or a camera on your computer. So, but we do not want to delay care in anybody. So please call your physician, make sure you're getting appropriate preventive care, getting medication refills, etc. We're also starting to open up surgeries in procedural areas. Our OR is open for business. The emergency department, regardless of the diagnosis, is open as well. All patients for all medical symptoms. So the operating room is opening up. Our procedural areas are opening up. So please, if there's a need, if there's a medical need, we are available to take care of patients. We have limitations based on state order in terms of the percentage based on what we were doing before COVID. We could only be at 50%, but that has been lifted. So we can do all procedures that we were doing before. So reach out to your physician if you feel like you have a need for that. Of course, it's been a big impact on our community, bigger than a lot of the rest of the part of the state, as you saw from some of these earlier graphs. Our organization has done an amazing job at responding to this, as has our region. We work very cooperatively with other organizations within this area, the state and statewide. It's really been great to see this response across our organization. Nonetheless, we have to be vigilant. We have to keep our guard up. Wear your mask, wash your hands, continue to only go out when you need to go out. Maintain appropriate distance so that we're not spreading the disease. We know that research has shown that people will get the disease, they'll get COVID-19, and even though they're not showing symptoms, they can be spreading it to other people. And so really it's about wearing that mask when you're out and about and not going out and about unless you need to. Again, the byline, I wear my mask to protect you, so you please wear a mask to protect me and those of us around us, especially those who are otherwise vulnerable. Thanks for tuning in. Remember that we're here for the community, and we're ready to do whatever comes next, and we're ready to help you, our community, as this continues to persist in our community. Thank you very much.